is a pleasure for Tonga Family Health on behalf of the board and the staff of this organization known as Tonga Family Health Association. We'd like to welcome US Peace Corps. It's always been our partner ever since the beginning of and the establishment of this organization. Before moving on, I would like to introduce myself. My name is Katherine Mafi, Program Manager for Tonga Family Health Association and also the Acting Director. This organization is the only sexual reproductive health non-government organization in Tonga. It was founded by His late Majesty King Kautaha Ngaue'ofa Amelika in 1970 and incorporated in 1975. So it's been more than 4 decades that we have been conducting this work as an extension hand of the Ministry of Health, especially with reproductive health. With regard to programs, this is an own program for Tonga Family Health Association. It's not one-off. And I believe it's also crucial for your awareness that we can't just talk about information with regard to sexual assault in Tonga and the reported cases that we have come across, but also be aware at the end of the day we need the services. Information is not enough in awareness. We need people to be aware of places where they can seek services, social services, and I think that's our critical role here with regard to handling this case in partner with other organizations such as Crisis Center for Women and Children and also Tonga National Women and Children Centers, Ngaahe Faingamalie. These are relevant partners, I believe, that we work closely with, but experience that we have, information is not sufficient enough. I believe in a safe space. We also created counseling space here at Tonga Family Health Association, and we have come a long way with regard to handling case and how to go about referring them for further diagnosis if needed. So on that note, I'd like to share with you the program that we conducted here at Tonga Family Health, where sexual assault is being addressed. First and foremost, we have you have to be aware that Tonga is currently reviewing the Ranaka policy, where sexual assault is being addressed. It's a national policy driven by the Ministry of Health, Reproductive Health Division. In addition to that, Tonga Family Health Association services, we provide what we call gender-based violence. Any cases that being presented, for example, are STI cases, sexually transmitted infection client. Once it's being presented, we treat, and also we need to do further screening, whether how they come about contacting the infection in the first place, where there assault and violence involved, for them to be in contact with it. So I believe having the safe space within the clinic, it's a need. With regard to home, we provide parenting training, and also we have what we call peer education for young girls and young boys. This is really important, when to draw the line of what we're teaching young people or young person with regard when to know all these risky lines, especially if they receive it either be on electronic messages or is it in verbal, how they can identify that this is an assault, be it a sexual verbal message or text message. And for your information, I have been driving this work with cybercrime unit in like push for what they known as Textuality Act 2013 for young people. This with regard to creating for their awareness, if you are being sexually assaulted on the phone via text message or through video calls and all, we raise awareness for young people that there are such act that protected their action. So in these I believe it's also for us to raise awareness. Now our young people are very much aware of it, but the general community. And another interesting program that we run also with teenagers, and it also raised by Filitono, our trauma group, teaching our young kids. I think it's building safe space by raising awareness of, we are looking at 3 to 5 years, teaching them public and private touch, because it's really hard in our culture for them to culturally identify this is, this touching or fingering. It has to do with sexual feeling, and like I said, it's sensitive, but it needs to be, the public need to be aware of it. And I think this is something that we need to talk about it openly, because I've come to realize over the years of running these kind of program in the Tongan context, people can't differentiate sacred information from secret information, such as sexual assault or sexual violence, sexual abuse. The terminology itself is just discriminating and challenging for us to culturally address it. But like I've shared with you, we always find it to not underestimate our young people. Sexuality starts from womb to tomb, and they are very much aware of it at a very young age. But I think it's crucial. We need to discuss it openly and raise the awareness. Is like I've said, it's a whistleblower. We're just raising a red flag here. Tonga, wake up. We are seeing cases, and I believe that is evidence-based information need to support these awareness programs. You can't just allude it to the fact that there's such thing going on. We have to raise the awareness in where to go. You can witness us building the safe space to discuss sexual assault with the community, even though there's so much laughter in it. But it's Tongan, it's culturally appropriate. The seriousness of the issue will be measured the degree of laughter going on. So it's the opposite kind of doing things, but that's how we are going to promote this course. And we are very much transparent about it. And like I said, again, the services is here, and it's here to stay and await people that have encountered any form of sexual assault. I would recommend, like, for example, building safe spaces. Very much depend on how you define a safe space. For me personally, and also on a professional note, we encourage parents, please create a safe space and find time to tala noa with your young person, with your children at home. We also want to highlight parenting as a training because we also seek not just to be aware, but we need to focus on a solution. How best can we address sexual assault in Tonga? With the Family Protection 8 program, they have created these new apps where you can click on it. I think it's really safe for sexual assault victim. You can press on it and seek legal help, and also you can press on it and you can seek services help. And for your information, we already have a national referral pathway for people that have been sexually assaulted. And I think these are the spaces from a service provision side. We have created these spaces for the Tongan community, and hopefully by this awareness I'll be seeing more clients coming into seeking our services here at Tonga Family Health Association.
Thank you very much for sharing.